Imagine being fresh out of the academy and getting a call that there is a baby not breathing. You run into the house with the parent yelling, "Please, save him!" You go to the baby and realize that the baby has been dead for quite some time. But you begin to perform CPR because the parents are begging you to save him. The ambulance arrives, taking the parents and the babies away. Later that day, you find out that the baby passed away from SIDS, and there was nothing you could have done. Now imagine being in a field where seeking help for mental health is considered being weak. How are you supposed to deal with that? According to the Firefighter Behavioral Health Alliance, which is one of the few organizations that tracks suicide for first responders, so far this year there have been 9 confirmed suicides. Just imagine how many have not been confirmed or reported. The American Security Council Foundation, which helps create programs for critical problems in the U.S., estimates that there are almost 1 million first responders within the U.S. Odds are you know one. Today I'm going to talk to you about mental health stigma within the first responder field and what makes it difficult for them to seek help for experiences like that one. Also, I will be talking about programs that are being implemented to try and help move the culture towards being more accepting of mental health. In an article called Firefighter Suicide, Understanding Cultural Challenges of Mental Health Professionals, firefighter culture dictates that mental health problems are a sign of weakness, vulnerability, and failure. Mistrust of a member who admits to these problems is a possibility. A fellow firefighter may feel this person is not stable and a risk to their personal health. Further pervasive within the culture is the traditional male values and macho identity. There is also an us versus them mentality, especially when it comes to first responders. To measure this, 2 years ago, I actually sent out a survey and received 1,500 participants asking how many first responders within the field have experienced traumatic events while on the field. 78.2% said yes, 21.8% said that they have not experienced a traumatic event while on the job. Of those, only 23% have sought help for problems within the problems while on the job from a mental health professional. 76.1% did not seek help. How do we fix this? Is there a way to help shift the culture of first responders to be more accepting of mental health professionals? One program that is starting to be implemented to help with resiliency training is resiliency training. In the article, The Efficacy of Resiliency Training Program, a systematic review and meta-analysis of randomized trials, says resiliency training programs are any program specifically designed to enhance individual, group, and population resiliency. The programs are forward-looking, seeking to prepare participants for future stresses and challenges. There is no standard for the program, but most will talk about what will happen while in the field and what happens if you do not seek help for your mental health issues. One of them being post-traumatic stress syndrome, and another major consequence being suicide. The programs are not currently mandatory, therefore most first responders do not have access to this training program. Studies are currently happening to look into the efficacy of resiliency training programs and their ability to help push the culture towards seeking mental health help. If you know a first responder, understand this first. Unless you have done their job, there's no way for you to understand what they're going through. I myself have no idea. I am not a first responder. But I have been studying them for 2 years now, so all my knowledge of them is still theoretical. The reason I'm talking to you about this today is because suicide rates among first responders is really high, and no one is talking about it. With this information, if you know somebody who is a first responder, I hope that you keep an eye on them and talk to them about seeking help for mental health if they need it. Maybe if we start talking about the issue someday, something permanent will be done to help those get help. Thank you.